So, my name is Breno Horsth. I'm working with the HISP Centre at University of Oslo. I'm the LMIS Tech Lead, so developing implementations for the logistics use case in DHIS2 software. I've been working with DHIS2 for nearly 5 years now, always in this role developing these use cases for logistics. Well, this academy, we've tried to bring together the approach of using both software in an integrated manner. So the idea is that you have DHIS2 as an HMIS broadly used, and you also have mSupply, which is a specialized supply chain and logistics software. In many countries, they're starting to use these two in parallel, and there are different cases for integrating in order to provide full value for countries. This takes a lot of effort to analyze the context and see the specific application, but it can provide a lot of benefit when done properly. I'd say there's multiple benefits. First of all, that you have different teams that are implementing these different types of softwares and systems, oftentimes in a siloed manner, and being able to align then functionality and both support, so we're talking about human resources, infrastructure, and so on, but then also the needs of users in collecting data, analyzing data. When these are better aligned between different software developers like mSupply Foundation and DHIS2, it provides better value. It's providing more efficiency rather than direct competition where sometimes you're developing overlapping features and initiatives. So this is an attempt to bring that a bit together, to align the work that we're doing in order to provide better tools for improved health service delivery. Well, there's probably multiple things that participants could have taken away. I really hope that on a higher level that they see the benefit of aligning resources, capacity in order to provide more value. I think that's really a high-level objective. And then on the specifics, which then lead up to that higher objective, it's looking at how they can analyze, for example, within a country, within a region, you can look at how different facilities have different capacities and different needs. It's not necessary to have the same solution rolled out at every single facility, but you can rather have a hybrid or tailored approach where you have correct data for decision making and that actually affects health service delivery by improving supply chain, rather than trying to force a solution that's perhaps not adapted for the context. To be honest, there were not any surprises in the sense that each DHIS2 academy, we're always bringing together country implementers. We're very used to having countries come with their DHIS2 use cases and showing something that we had never even expected or thought of. So in that sense, it hasn't been a surprise, but hearing some of the teams sharing how they've already integrated and are working on improvements between DHIS2 and mSupply, once again, shows that they're thinking way beyond what we're thinking at the broader software development level. They're on the ground supporting the ministry and supporting users, and that pushes them to be innovative and sometimes much more than we are looking at our high-level position. I would say the workshop was definitely a success. It brought together many different implementers. It brought together people with more mSupply knowledge who then learned about DHIS2, people with more DHIS2 knowledge who learned about mSupply. It brought together different teams from UiO, mSupply Foundation, and really HISP Rwanda, who brought together all of these different groups here and helped to facilitate this sharing of experiences, sharing of capacity, and then looking at what can be done when we work together. I think one of the things that I take away here is looking at how a collaboration between global partners developing software and then looking at how HISP Rwanda as a direct implementer working directly with ministries, and then the ministry themselves working directly with the users, how this chain of different stakeholders, implementers can collaborate and help provide better value. I think that's what we see. A theme, I think, running a bit below the surface has been the reduced amount of funding within this global health sector and working to build efficiencies in what we're actually developing, aligning investments in software development and then aligning our efforts in the actual implementation and country support are absolutely essential if we're going to overcome this funding gap, which seems to be something that we can't avoid.